Hi, I'm Rick Proctor, Clinical Education Consultant for DJO Chattanooga. Welcome to the Chattanooga Clinical Education Show Me series. Today, we're going to show you how to use VMS to facilitate and strengthen a quadriceps contraction. To do this, we are going to use the Vectrogenesis unit. VMS is an NMES waveform trademarked for the Chattanooga brand. VMS is only found on Chattanooga electrotherapy units. Research has shown VMS to elicit stronger muscle contractions and be a more comfortable NMES waveform for patients. Let's get started. The first thing we'll need to do is prep the patient's skin. We'll use a warm washcloth to remove any excess oil from the skin. Since the quadriceps is a large muscle, we'll want to use a larger electrode, and we're going to use the DuraStick 2x4 electrode. We will place one more proximally on the quadriceps muscle and one more distal to medial. We'll then plug the lead wires up to the electrodes. Now let's go to the machine. The first button we'll press is the electrotherapy key. Then we'll press the VMS key, and we'll select the VMS waveform. We'll then press the edit key to display the parameters that are to be edited. We will edit the parameters again to get our most optimal muscle contraction. You will note that the first parameter to adjust is the channel mode. It's set to single. That means we're going to use one channel and one set of electrodes on one muscle group. Should we wish to do two muscle groups, we can change the unit to reciprocal. We could place a second channel on her hamstrings. We could then contract the quadriceps, the hamstrings, and then have a rest period. For today's purposes, we're going to go with the channel mode of single. Phase duration. Phase duration on the unit is set at 200 microseconds. Since the quadriceps is a large muscle group, we really want to increase the phase duration. Longer phase durations will create stronger muscle contractions and recruit more motor units. So we're going to 300 microseconds. If necessary, we can increase to 400. Constant current, constant voltage. In this case, we want to set the modality to constant current. The purpose is this will maintain the current flow, again, to get an adequate muscle contraction. Cycle time. Cycle time has an on time and an off time. It currently is set to 10 seconds on and 50 seconds off. The 10 seconds would be the contraction time, the 50 seconds would be the rest time. For our purposes today, we're going to start with 10 seconds on and 30 seconds off. As the patient gets stronger, we will shorten the cycle time or shorten the rest times so that the patient will be able to get more contractions in during the treatment. The frequency is set at 50 pulses per second. This is so we can recruit fast twitch muscle fiber. Should we wish to recruit slow twitch fiber, we would reduce the frequency to 35 pulses per second. Ramp time is set at 2 seconds. The ramp time is the time it takes the current to go from 0 to its peak. We want the ramp time to be longer as this will be much more comfortable for the patient. The last adjustable parameter is treatment time. We want to reduce the treatment time to 5 minutes. Initially, we want short treatment times because of the fatigue the patient will experience. As time goes on, we will increase the length of the treatment time so that we can get in more contraction and build up the endurance of the patient. Now let's increase the amplitude. We'll now turn up the amplitude until the patient feels it. If this is the patient's first treatment, we will let them feel the current for a little while to adapt to it, to see what they're going to go through. Now we're going to increase the amplitude until we see a visible muscle contraction. Once we get the muscle contraction that we desire, we will press the start key and the cycle will begin. We will instruct the patient as the machine contracts, I want you to contract with the unit. When the machine turns off, I want you to rest with the unit. So she's contracted, now she relaxes. It is important during the relaxation time to reduce the fatigue of the patient so that they can achieve multiple contractions. As the machine then begins to contract again, we will instruct the patient to contract with the machine. The contraction will last for 10 seconds. And then when the machine stops, we'll ask her to rest again. Now let's show another application with VMS. In this case, we're going to try to create stabilization in a weight-bearing activity with our patient. The first thing I'm going to do with the unit is change the channel mode to co-contract so that I can contract two muscle groups at the same time. If you'll notice, there is one channel that has been placed on the quadriceps. We have placed a second channel on the hamstrings. We're now going to take and contract both of those at the same time and ask our patient to shift her weight to the surgical leg when the muscles contract, creating the stabilization of the hip and the knee. The first thing we'll do now is we're going to increase the amplitude until we get a muscle contraction with the quadriceps. We'll turn it up until she feels it. Once she feels it, we'll then continue to get the muscle contraction. Once we get the muscle contraction there, we will now set the muscle contraction for the hamstrings. Once we get the muscle contraction with the hamstrings, we will now press the start key. And now as the unit cycles on and both muscles contract, I want her to shift her weight to the bad leg. And when the unit turns off, we want her to shift her weight back to her non-surgical leg. When the unit turns on, she will shift again her weight to the surgical leg. Again, the current is stabilizing both the hip and the knee. This is giving her comfort to shift her weight to that leg. And now when the unit turns off, she will shift back. We hope you've enjoyed this tutorial on VMS and muscle strengthening with your Vectrogenesis unit.